Hey everyone, it's Sarah with registerednursern.com, and in this video I want to talk about something that many nursing students experience, and that is crying during nursing school. Few people will admit that they have cried because it makes them feel weak or overly sensitive. But the truth is that nursing students feel extremely overwhelmed because they have so much to do in order to get through the program. And crying is one of those natural responses that we have to help us deal with those intense emotions. So what are some reasons that you may cry in nursing school? You might have failed a test and feel really dumb. I've talked in another video about imposter syndrome and how so many nursing students and nurses feel as if they aren't really smart enough and that they've just fooled everyone. Or perhaps a clinical instructor or a patient or professor scolded you over something and you're really crushed. You might be exhausted and overwhelmed by just trying to juggle all your reading assignments, HESI, ATI exams, projects, and balancing clinical rotations. And finally, you might even get kicked out over a GPA or some other issue and you feel like your whole world is falling apart. So any of those things can lead to intense emotions that can cause you to cry. Now, some of you may be wondering, did I cry during nursing school? And the answer to this is absolutely yes, I did. But the thing is, whenever I cry, I hate crying in front of people. I cried at home in private because if I'm going to cry, I want to do it where no one can see me. But yes, I cried, and I'm not ashamed to admit it because nursing school was intense and there was so much to do, so much to juggle, and that's really what would get me. I would feel very overwhelmed because I would have clinicals I would have to go to, but I would have all these exams, I would have presentations, I would have to go to this meeting or that, and then just trying to pass HESI, it was just so much, and I would get these negative thoughts in my head and think, I'm not going to pass, I'm going to fail, this is horrible. And yeah, I would have those episodes where I would just boo-hoo at home. And the thing is that I found whenever I did cry though, I felt so much better, and I think that actually helped me be able to cope and to get through the program. So yes, I did cry. Now, if you find yourself crying and feeling very overwhelmed like how I did, here are some things that you want to keep in mind. So first, crying is completely normal in nursing school. I would say majority of nursing students feel extremely overwhelmed, which leads them to cry. So know that those tears that you're shedding, you're not the only one shedding those tears. Other people are as well who are in your program. And one thing I really want you to keep in mind is that everything is really going to work out over time. You know, maybe you had to take a different path to get to where you're going, but you will get there if you don't give up. So if you're watching this video and let's say you just recently failed a test, or you have to retake NCLEX, or something horrible happened in clinicals and it's making you question your whole nursing school career, the key is not to give up, but to keep pushing forward, and don't let those negative thoughts consume you, because I want you to remember that everything you're feeling right now is completely normal. I felt it. The second thing is that although crying is unpleasant to experience, you can actually use it for your advantage. So whenever you cry, you're able to release all these negative emotions that you have been bottling up. And how I like to think about it is, think of a pressure cooker. If you've ever seen a pressure cooker on a stove, whenever that pressure is building up in that cooker, it starts rattling and shaking and going crazy, almost to the point where it's going to explode if it doesn't relieve its pressure. So whenever you go over and lift up that lid, all that steam comes out, which is like your tears, you're crying, and it helps that pressure cooker calm down and not explode. So that's really what's happening to you. So whenever you cry, you're able to reset emotionally and think more clearly and get done what you need to get done. So after I would have a good cry, what I would do is that I would collect myself, I'd bust out my planner, and I would look at, okay, what's going on? What do I have to do to get this done? And I'd make out a list of everything I needed to knock out, and I would go and knock it out. And that's the thing about nursing school. It really forces you to prioritize your time and manage your time wisely, which really helps prepare us for the job. So I highly recommend, if you are in nursing school right now, to invest in just a simple little planner. You can get it at the dollar store, or you can be fancy and get like a digital one, but get that to help you stay organized. Now, the next thing you want to keep in mind is that you don't want to waste your energy thinking about those what ifs, like what if this happens? And I want to tell you, I am really really guilty of this. Like, what if this happens? And I think becoming a parent has really made me worse, but I think of the future and I think, okay, what if this happens? I'm gonna have to do this or that or that. And I have found that thinking of those what ifs never usually happen. It's always the things that I never thought were gonna happen is what happens. So don't think about, what if I failed this exam, or what if I lose financial aid, or what if I get through this whole nursing program but I can't pass NCLEX and then I never can work as a nurse. Don't go there with your thoughts. Instead, shift your focus onto something more productive and take that worry, turn it into action, and use that momentum that you're generating to do something really productive. Because before you know it, you will be graduating nursing school and be working as a nurse. And lastly, if you do find yourself crying all the time, let's say like multiple times per week, this may not be normal, especially if you're also experiencing episodes where you can't get anything done, you're having difficulty concentrating, you can't sleep at night, you're having insomnia, or you're sleeping too much, you're very irritable, you're having suicidal thoughts, or you're withdrawing from your friends and family. This may be signs and symptoms that you're having severe depression. And if this is the case, you want to get help. There's absolutely no shame in getting help with these things. So reach out to someone who you feel comfortable talking to. This could be a counselor, a pastor, a doctor, a friend, a professor, anyone who can listen to you and help you. And once you get help with this, get yourself healthy, then you can move forward. In conclusion, I know so many of you feel overwhelmed right now, and the reason I know that is because I was in that same exact position and I felt the same way. But the key is that you have to hang in there. So remember, it's okay to cry sometimes, and you're probably going to look back at this time in your life and be thankful that you actually stuck with it. So I want you to remember that you are doing something great. You're going to become a nurse. You're going to go on to save lives and help people. So you want to keep that in mind. You want to make sure that you stay positive and keep those what ifs out of your mind, and make sure that you keep pushing forward. And if you do need to cry, go cry, then dust yourself off and then keep pushing forward.